Imagine a world where you must choose between medical treatment and providing for your family, where your terminally ill child is further burdened with death-prolonging treatment, all for the sake of federal monetary gain, where you find yourself wondering if the care being provided is truly in your best interest. Unfortunately, this is reality for numerous Americans, as our healthcare system falls relatively short in comparison to that of other developed nations. Good afternoon. My name is Olivia Baum, and these are my colleagues Haroon Rashid, Lena Soupney, Alexander Oyster, and Allison Deek. Today, we will be analyzing the question, to what extent is the healthcare in the Netherlands and Canada more effective than that of the United States? According to the Universal Declaration of Human Rights, established by the United Nations, a person has a right to the highest standard of healthcare. In the United States, however, healthcare is considered to be more of a privilege than a right, as its affordability is limited. Doctors are obligated to treat their patients, yet a great number of people refuse this treatment due to the cost which it entails. In response to financial concern in the American healthcare system, President Barack Obama has enacted the Patient Protection and Affordable Care Act, yet it is still predicted that over 23 million citizens will be uninsured by 2019. Canada is a signatory to the United Nations Declaration of Human Rights and International Covenant on Economic, Social, and Cultural Rights, which mandates equal access to healthcare for everyone. This system proves to be more effective despite the fact that the government spends less on healthcare, allowing virtually every citizen access to it. This is testament to the ideology that healthcare should be considered a human right. Additionally, the Dutch are viewed as independent people, and their system reflects this greatly. The culture promotes an anti-medication attitude, which therefore leads to their citizens inhabiting a self-reliant mindset. After undergoing a major reform, a universal system has now been implemented to standardize the country. This is advantageous to the success of the healthcare system because not only are citizens granted equal insurance, but access to the same benefits.
According to pediatric palliative care coordinator Amy Deek, end-of-life treatment is often indicative of the overall quality of healthcare. Euthanasia, the medical termination of a patient's life by a physician, is widely perceived as murder in the United States. However, as seen in this graph, nearly 70% of Americans believe that it should be implemented. This is supported by several studies conducted by researchers Chachanov and Breitbart, who conclude that 59% of terminally ill patients who affirmed a desire for physician-assisted death were severely depressed and were up to 4 times more likely to desire accelerated death than those who were not depressed. From these statistics, one can derive the fact that without the freedom to choose forms of hastened death in the United States, depression levels among terminally ill patients may lead to increased suicide rates and other self-harm. Such suffering may prove burdensome on the providing physician, as they then have to evaluate whether their care is prolonging life or prolonging death. According to the Ontario Court of Appeal, a Canadian physician is not allowed to disregard their patient's advance wishes concerning their death any more than they are allowed to disregard instruction in an emergency situation. This ensures that the physician has the best interests of their patients at the forefront of their mind. Additionally, in the Netherlands, euthanasia is conducted by several physicians in the country, drawing praise from right-to-die advocates worldwide. According to the Termination of Life on Request and Assisted Suicide Act, the physician must be completely convinced that the patient is suffering unbearably, cognizant of the weight of their decision, and convinced of the hopeless prognosis. In addition, an uninvolved physician must also evaluate the patient and agree with the request before conducting euthanasia. As evident through this plethora of safeguards, Dutch policy is based on patient-focused ethical logic.
The United States has been the subject of relentless criticism for the poor accessibility of its healthcare. This is because the U.S. does not have a uniform healthcare system, offering universal coverage, and is privately run instead. The problem with this arises when it is revealed that about 44 million Americans do not have access to healthcare insurance in a nation where almost all access to health-related services depends upon the possession of insurance. Simply, the high cost of healthcare make accessing care in the United States extremely difficult, as more than 37% of American adults reported foregoing a recommended test or treatment for cost-related purposes. Furthermore, according to a new report by the Commonwealth Fund, the United States ranks last in all measures of cost-related access when compared to 10 other industrialized nations around the world, including Canada and the Netherlands. As my colleague mentioned earlier, Canada and the Netherlands have a system of universal healthcare, meaning all people are entitled to healthcare and all people have access to it. Furthermore, the Dutch system is actually fully provided for by private insurers, who are required to provide low-cost care to all people, regardless of illness or sickness. Also, though the United States may have more resources in total, Canada and the Netherlands have been able to achieve widespread equal health care through the equal distribution of their technological, human, and financial resources. Dr. Munir Pirzada, a general practitioner at the Manitoba Clinic in Winnipeg, Canada, stated that though there still exist many problems within the Canadian and Dutch healthcare system, at the end of the day, we have to realize there exists better and more proper access to care for Canadian and Dutch citizens than Americans.
The United States, as of 2012, has 47.6% of its healthcare spending coming from public sources. This healthcare spending and its percentage of the overall gross domestic product has greatly increased over the years. Ultimately, the funding for the healthcare system in the United States comes from the people. The only element that varies is how it gets from the people to the government, through taxes, premiums, and out-of-pocket payments. Canada's healthcare system is 70% publicly funded, and one form of distribution of funds in Canada are global budgets. The University of British Columbia states that a global budget is where a fixed payment amount is allocated to a provider, such as a healthcare authority or a hospital, to cover operating expenses for a period of time, usually 1 year. The advantages of global budgets are that they make for predictable spending and lower monetary incentives for providing unnecessary procedures. Moving on to the Netherlands. As a result of their healthcare reform in 2006, low-income earners do not receive low levels of healthcare, as they are granted a healthcare allowance from the government. This is called guaranteed issue, which is when an insurance plan cannot refuse coverage to a health enrollee based on their health status, thus guaranteeing insurance protection to the very sick and those with so-called pre-existing medical conditions. To make an overall comparison, the United States, Netherlands, and Canada spend 17.6, 12, and 11.4% of their GDP on healthcare respectively. Furthermore, Canada and the Netherlands spend $4,602 and $5,219 per capita on healthcare. The United States, however, spends nearly double the amount that Canada does, $8,745. This shows that the United States spends more on healthcare, yet the quality, as my colleagues will argue, is significantly lower.
It must be acknowledged that hospitals in the United States are newer and better equipped than those in Canada and the Netherlands. As stated by Senior Health Policy Analyst Michael Borowitz, the United States pays higher prices and has a greater volume of services, particularly high-tech, and lets technology run rampant in the system. Despite this fact, many Americans still do not receive the care that is necessary, as the healthcare quality seems to fall behind when compared to the Netherlands and Canada. In fact, Amy Deek believes that quality care is not available to every citizen. Oftentimes, patients are treated according to what insurance they have. A study from the Agency for Healthcare Quality and Research found that potentially preventable medical errors that occur during or after surgery may cost employers nearly $1.5 billion a year. Evidently, this increases costs and reduces the productivity of the healthcare system as a whole. On the other hand, the Canadian healthcare system proves to be relatively superior. Infant mortality rates per 1,000 live births are 10.4% in the United States compared to 7.9% in Canada. Similarly, life expectancy is less in the United States than in Canada at 75.3 and 77.1 years respectively. When evaluating the holistic quality of care in the Netherlands, it is necessary to consider the Dutch Healthcare Performance Report of 2010, which affirms that more than 90% of Dutch citizens were satisfied with the interaction between themselves and their healthcare providers. This can be attributed to a strongly developed primary care, clinical, and outpatient care system in the country.
In conclusion, all three of these developed and industrialized nations have their own unique healthcare systems that were tailored in theory to provide the most effective care for their respective citizens. However, when we compare the United States to nations such as Canada and the Netherlands, we see that it falls behind greatly. Now, to improve the American healthcare system, we must review all these separate factors very carefully and even model them after successful nations such as Canada and the Netherlands. Although reform may take time, it is crucial to undergo such transformations in order to better provide care for the American people. Thank you.
I'm done with the question. Thank you, guys. All right, so again, in the form and start, we'll go right over. Okay. Lena, where did you personally grow the most as you went through this?
I would probably say the part about Canada. I had a really hard time finding information on the quality of care in that country, and so I was very limited to what I didn't have enough information to include, so I had to elaborate and based on the statistics I had for the other countries, and so still had, it was like the same for every country. Like in the end, it all came together.
Okay, thank you. Harun, tell me something something that inspired you in the research as you went through this.
Something that inspired me to do the research? Or
No, as you went through it.
Okay. As we went through the research, one of the most striking things we found out was about the end-of-life policies and how in the United States it's not as, I mean in the Netherlands and Canada it's much more complicated and there's much more safeguards you have to go through. And we just found it was really striking, and I especially found it really striking, that in the United States they don't have those many safeguards people have to go through. So there's just not as much, it's easier to have what you want to do in other countries, and the United States are so restricted that it's just not fair to the people.
Okay. Look, tell me about the reliability of your sources and how you check the reliability of those sources.
Well, throughout our paper, we used quite a few primary sources like interviews from reliable doctors, people who have experienced the system firsthand. And we also used a number of medical journals and studies, especially one from the Commonwealth Fund, which happened to fit into a little bit of everyone's section. And it was a study over 11 nations and their healthcare system, so it was pretty helpful.
All right, thank you. Again, a group of 5 people. I'm curious, Ali, tell me about how you handled differing perspectives as you went through the process.
Well, it was kind of difficult at the beginning because we all kind of had our own lens on the situation and we all wanted to put all of our ideas into the paper, but as we went through, we kind of discovered the weak points and the strong points of everyone's different perspective, and we were able to kind of weave those together so that we could create a cohesive argument and make sure that all of our statistics lined up and all of the arguments were in line.
Are you happy with the end result?
I am happy with the end result. It was a lot of work, but it turned out well.
Okay. And on that, if you had more time, what more would you have done?
If we had more time, I would have liked to look at what are the necessary qualifications to become a doctor in each of the separate countries. Because no matter how good the healthcare system is, if the doctors themselves aren't qualified enough to treat you accordingly,